New details here at home after weeks of rising COVID-19 case numbers across the country. These rising case numbers are pushing hospitals to the breaking point, and the impact is being felt worse in Michigan and Indiana than almost anywhere else in the United States. 16 News Now reporter Jack Springate spoke to healthcare workers who say they're experiencing horror stories behind hospital walls every day. And Jack, why are health leaders here saying this could be one of the darkest moments in the pandemic?
Well, thinking of it this way, Terry, there were roughly 45,000 new hospitalizations due to COVID at the beginning of November. Now, 4 weeks later, that number is at 58,000. And Michigan and Indiana are two of 6 states that account for more than half of all the new coronavirus hospitalizations in the last 4 weeks. Michigan is at the top of that list. Now, I spoke with a nurse who works here at Beacon Memorial Hospital, and she says she no longer sees the light at the end of the pandemic like she did earlier this summer. Michigan accounts for more than 13% of the new COVID hospitalizations in America over the past 4 weeks, the most of any state. Indiana makes up a little more than 7.5%. They join 3 other Midwest states and New York to make up 60% of the new COVID hospitalizations in the U.S. That's too much for our Michiana hospitals to handle.
We had a patient today who said, when we told him he had COVID, he said, "Oh, is that real?" There's people who don't think this is real. This is real. This is a pandemic. It's still going on.
Burlingame is one of the nurses on the front lines at Beacon Memorial Hospital. Even though she's still treating patients after more than 20 months since the pandemic started, burnout led to many other nurses to quit long before the current surge in hospitalizations.
Some of the way that people are taking their frustration out on the nursing staff also adds to the burden that we're seeing. We're exhausted.
Health officials in Michigan say it's critical for people to get the COVID vaccine or booster shot to avoid going to the hospital. Not only are you 6 times more likely to get COVID if you're unvaccinated, but you're also 10 times more likely to need hospital care and 10 times more likely to die from the illness compared to those who are vaccinated.
That's not age adjusted. If you're 50 and have diabetes and hypertension, your chance of going to the hospital or dying may not be 10 times, it may be 50 times greater or 40 times greater. We know the vaccines are a much safer way to get an immune response than is the disease.
Still not out of the Delta variant surge, health experts say people need to protect themselves by taking the vaccine before the next big wave.
We're seeing patients in hallways. We're doing the best that we can to get everyone seen. Obviously, our goal is to take care of every patient who comes in through our front door and wants our assistance. We're having a really hard time getting that done.
Now, a couple other takeaways that I got from my conversation with these health experts. If you're tired of hearing about the pandemic, if you're tired of living in the pandemic, it's time to get vaccinated. It's time to get boosted. That's not only the first step, but it's also the easiest step that's way safer than the risk you take by getting infected. And also, we gotta keep washing our hands, wearing our masks when we're indoors, social distancing when we're indoors. Dr. Hamill at Spectrum Health says that he expects there to be a 5th wave of the coronavirus with the Omicron variant on the horizon. And not only can these mitigation factors help us get out of the Delta surge, which, yeah, the Delta surge is still happening. We're in the middle of that, but it can also help us minimize the impact the Omicron variant has on our communities. So while it might be frustrating to have to hear about COVID day in and day out, it's not nearly as frustrating as what some of these nurses tell me they feel when they have to keep seeing countless people die day after day from a disease that is preventable. Terry?
All right. Jack Springate reporting live tonight outside South Bend's Memorial Hospital on the north side. Jack, thank you very much.